This is my vaccine case study by Emily Simmons. Okay, my infection is hepatitis A virus, and this is a viral infection that's also contagious. This virus causes an individual's liver to become inflamed, causing various symptoms and signs, which are usually mild but can be severe. This happens by a hepatitis A virus replicating within the liver cells, ultimately signaling an immune response. And then these immune cells are then responsible for eliminating the infected liver cells, which then can cause inflammation in the liver. This inflammation alters the liver's ability to function as usual, thus causing signs and symptoms. Hepatitis A is a worldwide virus, with some countries struggling more than others, mainly lower developed countries. Since the discovery of this viral infection, there has been much research and studying done to understand what it is, how to prevent it, how to treat it, just all the information about it. Hepatitis A is spread through contaminated water and food. You also can get it from being in direct contact with another individual who's infected. This is prevented by a vaccine. The usual recovery time is short and can be treated. Death and severity for this infection is relatively low compared to other infections, with only some cases being severe. Okay, the epidemiology. This is an endemic, which means that many people around the world can be infected and will be infected, but specific areas in general have higher levels of this infection, which causes it to be an endemic. Areas like certain areas in Africa and Asia are prone to this infection, making this an endemic. Anyone that lacks this hepatitis A vaccine is at risk of getting this infection, just because the vaccine is highly preventable of getting the infection. Other individuals that are at risk of this are travelers, since they usually go to areas that they are not vaccinated for. Men who have sexual relations with other men, people who use injections or inject themselves. These are usually drug users, and I'm assuming that they're at risk because of the unsanitary that they're using. The homeless community, again, I think this is because of sanitary reasons. Then HIV and Hep B and C patients, along with people who have chronic liver diseases, are also at high risk of getting this infection. If you do have this infection and you do not treat it, or you don't get a vaccine or any of that, and you are just living with this infection, you can get acute liver failure, and this can ultimately cause death in a lot of patients. But this is very severe, and this is only for patients and individuals who decide not to cure hepatitis A. Transmission, like I kind of explained in the abstract, it's fecal oral, so basically if you intake contaminated water or food, you're very likely to get this. Also direct contact, if you're around anyone that has hepatitis A and you are near them or directly touch them or just come in close contact with them, then you are more likely to obtain this infection. Some historical and present incidents of this. Historically, the first case was found in China about 5,000 years ago. So that's where it started, and that's where people first started to learn about this and what it is. And then during World War I and II, there was a significant outbreak that occurred. And I read up on this, and it said because of how unsanitary it was, and how they weren't using good sanitary practices, and exposure to areas that they weren't vaccinated for was a big reason of why there was such a big outbreak. I also read that in the Civil War there was a significant outbreak, and I think that this was mainly due to the sanitary problems and them being unsanitary. I don't think it has anything to do with the area, since Civil War was in the United States. So yeah, that wouldn't really make sense. Then the present incident of this is in February 2023. There was frozen strawberries that were contaminated with hepatitis A, and they were imported from Mexico. And fun fact about this is that I think in 2022 or 2021, there was also an outbreak that happened, and it was linked back to the same farm in Mexico that correlates with this outbreak. So I thought that's not cool, but like it's kind of cool to see that they were connected in a way. So 10 people reported having cases of hepatitis A, and 4 were hospitalized. I also read that they assumed that there was more cases from this since the strawberries were distributed throughout America, but they think that they just weren't reported, so they couldn't get the data on that. But still, 10 cases reported is a lot from just frozen strawberries. Okay, and then the prevalence and mortality. So for prevalence, I have this pretty little chart up here. And this is incidence of hepatitis A in the United States from 2011 to 2018. So as you can see, from 2011 to about 2015 and 16, the rate for this was relatively low. And then in 2017, we see a little bit of a spike. And then obviously up here we see 2018, which expanded or spiked up a lot. And I know you can't see this in the graph, but I also read up that in 2019, there was even a higher amount of cases than 2018. Then after that, in 2020, it lowered a little bit, and then 2021, it also was a lot lower. But still, there were cases of it throughout all of these years. So yeah, I would say it's very, it's very, in the United States, it's very uncommon. But in other places, I would say that it is common, and they do have a high report of that. And then for mortality, I read online that in 2016, there was 7,134 people who died from hepatitis A worldwide, which sounds like a lot, but in the spectrum of how many people we have on Earth, that's actually really, really low. So that's good for that. And then in 2020, there was 179 deaths just in the U.S. And then I also read up that they estimate that 7,134 people each year die worldwide. Again, this is also just an estimate that I read up on a website or an article. So I don't know. I also just now noticed that the people that died in 2016 worldwide is the same as the estimated number. So I don't know if maybe that has something to do with that. I don't know. I'll have to look up on it more, I guess. But that's pretty cool. But yes, 7,000 is around the mortality rate worldwide for this, which again is not very big in scope of everybody on Earth, if that makes sense. This chart shows people in the USA that have died from this infection in 2017 by age. So obviously we can see that people 65 and older, usually in the United States, at least for this year, died from this infection. And then 45 to 65 had some type of infectious rate, but definitely a lot lower than 65 plus. And then 0 to 44, I guess there was no deaths for this age category in 2022, which is super good. Good for them. I didn't read anything about this, but I'm assuming that people 65 and older might have a higher rate during this time just because their immune system might be deteriorating or things might not be functioning correctly. But I also assume that people that are super young might have some deaths to this too because their immune isn't fully developed. But I guess I was wrong. But yeah, I just thought that this chart was cool just to see how age also kind of plays a part in this, at least in the United States. Okay, etiology and pathology. So hepatitis A, its scientific name is hepatitis A virus. And then the symptoms and signs from this is fever, diarrhea, nausea, discomfort in the abdomen, darkening of the urine, loss of appetite, and there was other symptoms and signs. One of them, I can't remember what it was called exactly, but basically the white part of your eye starts to turn yellow. This is in severe cases, but I just thought that was not cool. I think it's cool, but not cool if it were to happen to me. But yeah, that's just another symptom sign. So these symptoms and signs are usually revealed within 15 to 50 days after you're exposed to the infection. And these signs and symptoms usually last 2 to 3 months. And some people, I guess just depending on your immune system and how efficient it is, it can be longer. I read up that some people it lasts up to a year. Other people, it was 6 months. But yeah, usually on a bunch of the websites or articles that I read upon, 2 to 3 months was the general amount of time. These signs and symptoms are usually mild, but can get severe. But in most cases, it is mild. In severe cases, it's very, very rare. Usually adults are more likely to obtain these signs and symptoms over children, and I researched and it said 70% of children that are infected with this are asymptomatic, and this is probably just due to their immune system being less developed. And then prevention and treatment, there's no specific treatment for this. They usually just try and work on revealing your symptoms and stuff like that. And then just making sure you have enough water and that you're staying hydrated and that you're getting a good nutrients intake. Because this infection does go away by itself if you are infected with it. But again, having good water in your system and having good nutrients in your system will definitely probably help it go away faster. So that's what I would definitely do if I was infected. And then prevention for this, honestly, on every website that I read about, an article that I read about, it says that your vaccine, getting vaccinated, is the best way to prevent this. So I would definitely recommend that to anyone who is scared of getting this infection. Other ways is to practice good sanitary practices or have good sanitary practices. Practice having safe sex, having good intake of safe food and water, making sure that it's not contaminated and that it's reliable and it won't get you sick. Then for people who are who live in high areas of hepatitis A, I also would suggest just staying home as much as you can, just because you don't want to get infected by someone else in your area, since there is high levels in certain areas. But for low hepatitis A countries, I would not recommend this just because it's not as scary, since not as many people have it as in other countries. So yes, that is my advice. And then laboratory diagnosis. There were two laboratory assays that I read upon, and the first one is hepatitis A antibody test, which is a serology test. So this tests for antibodies in the blood that work against Hep A. And it basically just checks your immune status, and it detects present or past exposure to Hep A. And this can cause a false positive if patients that get this test was already vaccinated before testing. So if you are going to get this test, you should definitely know if you're vaccinated or not, because it's pretty useless if you are vaccinated. And the second one is reverse transcriptase PCR or RT-PCR, and this is a molecular test. And this detects HIV in the RNA and stools and serums. It's very, very specific. So usually there's no misdiagnosis and it's pretty accurate. But in some cases, there are false negatives if you test too early or late, or if you give a bad or invalid sample. And then a false positive can be from cross-reaction. I also read that these two tests work hand in hand, so it's pretty good. Maybe if you want to try doing both, I don't know if that would be recommended, but I did read that they work pretty good together. But if you just get one of them, I'm pretty sure that's accurate enough, to be honest. Okay, then the vaccine. I actually read that there's 3 vaccines that one can get to prevent this infection. The first two are Havrix and I think Vacta, as you can see, and it's the first and second picture, right? Yes, first and second picture. These are inactivated vaccines, so basically they take the pathogen and they destroy or whatever, just so it can't replicate inside of the person once it is injected. So for this vaccine, they do 2 doses. You take 1 dose, and then the second dose occurs 6 to 18 months later. The third vaccine is called Twinrix. This is also an inactivated vaccine, so obviously they take the virulence out of it or whatever, by heat or radiation, whatever, and just to make sure that they don't replicate once they're inside of you. It's also a combination vaccine, so this actually prevents hepatitis A and hepatitis B, but it's mainly for hepatitis A. So if you were worried about hepatitis A, I would consider doing any 3 of these vaccines. This is 3 doses, so you take 1 dose, and then you take a second dose a month later, and then the last dose occurs 6 months after that. I also researched about this, and some people have different time lengths for when their first, second, and third doses, but this is just a general idea of when you should do it that I read about on most of the websites and articles. If you are traveling and you don't have enough time, 6 months or however long, to get a vaccine, they recommend that you get 1 dose of any of these vaccines plus a dose of immune globulin for anyone that can't get a sufficient amount in a good timely period. The benefits of these vaccines is they are highly accurate in preventing hepatitis A, so that's a big main prevention. They prevent other complications related to hepatitis A, like other symptoms and signs and things like that. And it is a long-term protection. So if you do this, if you get this vaccination, you are protected long-term. So that's good. The risks are your injected site can get inflamed, so redness, soreness, things like that. But it's very short-term. It's not long-term. You can also have fatigue, nausea, headaches, and other symptoms and signs like that. Then a very severe risk is that some people get allergic reactions after they take this vaccine or are injected with this vaccine. But that's very, very rare. It doesn't really occur often, so that's good. But these other ones, these other risk factors, they're very mild in most cases, and they're very short-lived. This vaccine doesn't cause any long-term disease, which is good. So the risks aren't honestly that bad. It's very usual vaccine risk factors for this one. Then about the anti-vaxxers, I read up in research about this, and they said that most of them are afraid to get vaccines because they think that it might cause the disease that they're getting vaccinated for. I also read that they think that there's a linkage to autism. Some people have religious practices or beliefs that they just don't get vaccines, which is perfectly fine for them. And then some just prefer natural over vaccines. Some people don't want to get vaccinated. Some people just think that it's unnatural and they just don't want to do it. So those are just some reasons that anti-vaxxers might have reasoning for not getting a vaccine. However, in my opinion, I don't really like this idea, to be honest. I just think that the benefits of the vaccine definitely outweigh the potential risks. Since the risks aren't long-term, they're not really, in my opinion, quote-unquote bad. Like, obviously, I would not want to have headache or have an inflamed injection site, but I'd rather have that than hepatitis A. So that's my opinion on this subject. And I definitely think that they should promote vaccinations and make it mandatory. Just because I think it's very beneficial, to be honest. I think the benefits definitely outweigh the risks, and I think will help a lot of people. I just think people also don't realize how vaccines work, and maybe that's also why they might not want to take a vaccine. But for me, as someone who's been learning about it, yes, I think that it should definitely be mandatory, and I think that if people don't think it should be, that they should research about it and research how life would be without these vaccines. So that's my opinion. This is just another graph to show the rates in the U.S. of hepatitis A. So in 1995 was the first year that they introduced the vaccine, and in 1996 it kind of started becoming a normal practice. So obviously we see in 1995 high rate of hepatitis A in the U.S. And then it kind of goes down and down and down as we see. So this just shows like how the vaccine did have an effect on the population as we see higher numbers. A lot of the websites did have different numbers for total amount of people who have been infected. But I think this gives a good overall idea of the vaccination and how it works. And yeah, I think it honestly worked pretty good. So yeah. And these are my citations. There's a lot. I looked through a lot of different websites. But yeah, hopefully I covered everything. This was really cool to learn about. So yeah, hopefully I didn't bore you. And thank you for listening.